The NHS recommend that people who are sexually active test every 6 months. With the kind of vulnerable groups that we often work with and people who are at risk, we recommend people who are sexually active to test every 3 months. It's very important as part of the treatment to get treatment as early as possible, so an early diagnosis will avoid a lot of problems that could occur, a lot of issues that could occur, as opposed to a late diagnosis. Spectra provide quite a wide range of services. We do things like sexual health testing, including HIV and STI screening. If you wanted to test with Spectra, you can access our website at spectra-london.org.uk, and it has an interactive calendar map online. Once you've spoken to our outreach workers, there's 2 methods you can test for HIV. One is the rapid testing. It's a lot like testing for cholesterol, blood sugar, things like that. So it's a small, sharp prick that just take a very, very nominal amount of blood, and then using that, the kit produces a result in less than 5 minutes usually. The other one is slightly less intrusive swab testing, which is a saliva swab, which usually takes about 5 to 7 working days to get a result back.
We actually work in the community as well. So with our drop-in sessions, which is a triage into any of the services that we provide, and it is about being visible and letting people know that there is an organization like Spectra in the community for the community.
Advise that to get tested perhaps every 3 to 6 months, and one of the best things about being able to do it with Spectra is I can look on their website, I can see what different venues they're at. The good thing about coming here today, it's in a library, it's kind of discreet. I'm talking to people who are like me, there's no judgment, there's lots of advice. And there's free resource available as well, so it's great, and I can just kind of rock up, get tested, and I'm perhaps in and out in about 20 minutes.
The thing about getting tested early is that if you do have the virus, you can get onto treatment, and a key note with that is that you become undetectable, and that's a key word because you are not going to be able to pass over the virus to your sexual partners.
HIV treatment has transformed the health of people with HIV, so if you're on treatment now, you're going to live a normal life expectancy, you're not going to be ill, you can carry on living your life, and importantly, you can't pass that infection to anyone else. So once you come into Falcon Road, we'll give you a triage form to complete, which asks you just questions about why you're here and any symptoms that you have and what sort of any risk you've had and any concerns you've got. Once you've completed that, then you'll be seen by the most appropriate person. We talk you through your history, ask you lots of personal questions, but we're used to asking those questions. It's really just to get background information so that we can know what's the best test to do for you. If you need to have venous blood taken, so a blood taken from your vein to send off to the lab, then we'll talk you through how you feel about having the tests done. Then we take the blood, send it to the lab, and then they process that, and then you'll be texted directly with your results. Obviously, if it was positive, then we'll give you a call and bring you back to the clinic to talk about those test results. So the most important thing is to test yourself so that you know your status, so you can protect yourself and protect others.